some parts of Bangalore was waterlogged 2 weeks back or a week back. And when things were waterlogged, it was joked that people are joking that we don't even know where our sewage is going. But the sorry state of affairs within ourselves is that as individuals, we don't even know what happens after our food goes to the stomach. We do not know the rest of the part, what happens. So, except that when we have a painful problem, we start thinking about it. Otherwise, we do not really think about it. Today, in our monthly series, we bring you from Optima Hospital, Bangalore, to talk about bowels and its irritations. And to talk about bowel and its irritations, we have consultant gastroenterologist Dr. Vidyasagar and consultant psychiatrist Dr. Divyashree. To just remind you, we will have, at the end of the session, you will have time to type in your questions in the Facebook Live. We will answer it. We have tried to make the whole talk comprehensive so that you may not have any questions. So in case you have questions, feel free to type in and we'll be able to answer at the end of the session. Dr. Vidyasagar, I would like to go to you straight away here. Ganesh Chaturthi just passed and I had a detailed feast on Ganesh Chaturthi. And after that, I felt really uncomfortable. That happens whenever I have a very heavy meal. As usual, popped in a few pudin haras and it's solved. But is that an underlying cause of bowel conditions? Is that so? Essentially, if we take a step back here, Dr. Vidyasagar, is this what is bowel and what is bowel movement all about?
First of all, good evening, everyone. Welcome to the Health Education Clinics. Yes, thank you for asking that question. Bowel means gastrointestinal tract, or in simple words, it's your digestive tract. And rather than answering what is bowel movements, the digestive tract has various functions. First of all, assimilation of the food, mixing of the food, and then absorption of the food, nutrients, and then elimination of the unwanted waste products. And this happens through a series of coordinated and well-orchestrated movements called as peristalsis. There are much more finer movements that occurs within the digestive tracts, which help in these kind of processes. When everything occurs in a synchronized manner, it is like music. When things are not synchronized, it is noise. And this is what we call it as irritable bowel. Not all symptoms are irritable bowel. So yes, when you have a feast, a wedding, or something, you may have a little bit of upset in the digestive tract, maybe because of a variance in the food that you've eaten, the quantity or the texture. But when these symptoms or any irritation or any symptoms from the digestive tract are prolonged for a long periods of time, maybe several weeks or even going on to months, that's when we need to think about the possibility of a condition called as irritable bowel.
All right. So it's not like sporadic incidents need not really be IBS.
Not necessarily, but many a times they're present sporadically.
Okay.
But when we dig into the history by talking to the people, usually they trace it back to quite a few months or weeks or even years for some people.
All right. Got it. So that explains to us as to when we can suspect that somebody has irritable bowel syndrome. So, Dr. Vidyasagar, with prosperity comes gastritis and acidity and things like that. How do we differentiate? Is this a part of a package called IBS or is it very different? Because everybody has these two things.
Correct. Because everybody has a digestive tract and it has its movements. Sometimes things can get derailed and you can have these kind of symptoms. There's a larger universal set we call as functional gastrointestinal disorders, of which irritable bowel is the commonest. Many people experience symptoms like bloating or feeling very full like a balloon. They call it as gas or gastritis. In gastritis, in pure medical terms, it may mean different to a consultant or a clinician. But for a commoner, gastritis is generally described as feeling of bloatedness or passage of a lot of gas from below or belching from above. Sometimes they can have altered bowel movements, which can be either very slow and sluggish, which we call as constipation, or sometimes it is quite rapid, where we call it as looser stools or diarrhea. Sometimes it can vary between the two. And of course, bowel also contains gas. The elimination of gas may be infrequent, where it's all trapped, causing bloating, or it can be very frequent, causing flatulence.
Okay, got it. So that explains well as to where we should really suspect, be going beyond just acidity and gastritis, as we call everything as under those two diseases. Anyway, so Dr. Vidyasagar, I mean, which specialist should we go? I mean, because this is something which we do not know. Many people, if you have a back pain, you know you should go to a you should go, you know whom to go to, and if you have a few other things, you know which specialist to go to. But in this case, when you get all these, which specialist doctor should we really approach when such something like this happens?
So, any basic problems, I would always advise that people consult their own family physicians. The family physicians in a general curriculum in a medical school, every physician who passes out of their medical school are taught to diagnose these conditions based on the symptomatology, running a few tests. However, when problems or symptoms are persistent, that's when you need to see a specialist for exact diagnosis or to exclude other mimicking conditions which can mimic like irritable bowel syndrome. And that's when a digestive disease specialist, called as a gastroenterologist in medical terms, is the person that you need to consult.
Okay, doctor. Doctor, one more thing that people feel is a taboo about this subject. So when should they, I mean, stop feeling stressed about going to a doctor about these things and start, I mean, I should approach a doctor and put an end to this.
I think there's a saying in Kannada, udara hotte novugulu, udara problems. They are quite nasty, and many people don't think it as a taboo. They think it as a sort of a immediate necessity to go and seek some medical help. Certainly, I mean, the doors are always open for the hospitals and the clinicians. So please do help yourselves by consulting one of the doctors to discuss about your health problems.
Got it. So that explains mostly my kind of problems. Anyway, Dr. Divyashree, this is a question for you. One of my friends, Rahul, he ran several tests because he felt something was in his abdomen, or I mean, he had symptoms of irritable bowel syndrome, including he did endoscopy and things like that. But all the tests came kind of okay. But he still has a problem. But one thing that I talked to him is that his work life is pretty stressful. So is there a relation between mental health and irritable bowel syndrome?
Yeah, absolutely.
Okay.
So the relationship between the brain and the gut, that is the intestine, intestine, is actually very complex and very interesting. We say that the gut has a second brain, which means that the same kind of a neuronal structure, the same kind of nerves, the same kind of neurotransmitters that are there in the brain are also there in the gut, right? So obviously, if there is something wrong with this, neurotransmitters or this nervous system in the brain, it is bound to reflect in the abdomen.
Okay.
So most of the time, what we have noticed is that when a person has been diagnosed as having irritable bowel syndrome and has been referred to us, we do see a relationship between stress and worsening of their symptoms.
Okay.
So, for example, if there is an exam that they need to go to, or if there is a marriage that that is coming up, or a divorce, it usually the symptoms, their abdominal symptoms worsen. So that is where the overlap between mental health and the GI system comes in.
Okay, all right. So if to ask more about it, I mean, some of the gastritis problems like acidity, and it could that be a result of anxiety, increased anxiety and stress? Is that the reason why sometimes when we see something very horrible, they describe it as gut wrenching? I mean, yeah.
Exactly. Yeah, I think you got that right. Sometimes, a lot of patients go to the gastroenterologist saying they have this, queasy feeling in their tummy, or
Okay.
they feel butterflies in their stomach,
Ha, ha.
right? They go to the gastroenterologist. The specialist runs a battery of tests. Everything seems to be normal, including biopsies and things like that. And then they're referred to a psychiatrist. When we take a detailed history, it looks like they seem to suffer from what we call panic disorder.
Okay.
Okay, so panic disorder is an anxiety disorder where it is brought about by stress, where people have palpitations. It can manifest in different ways. Palpitations. Sometimes they have tremors in their hands, difficulty breathing. It comes in brief intervals of intense anxiety. At the same time, they can have abdominal hurry. They need to rush to the toilet and pass stools. So they end up thinking something is wrong with their abdomen, with their gastrointestinal tract, and that is why they end up with the gastroenterologist. But eventually, once they have been assessed, they come back to us. So definitely there is a relationship between the way the symptoms manifest
Okay.
and the mental health.
Okay.
One more thing I want to tell you here, there are certain other mental health issues which can manifest as, with just gastric symptoms. For example, loss of appetite in depression.
Okay.
Okay, so sometimes you just lose appetite, you don't know what reason, and they go to the doctor, and everything is assessed, and then they get sent to us. So we should not forget that the brain and the body is interconnected, and anything that affects the brain can affect the rest of the body.
Okay.
So don't be surprised if your gastroenterologist sends you to a psychiatrist, and don't wonder, why am I being sent like this?
Okay, got it. Sure. Dr. Vidyasagar, one thing is once we find that somebody has IBS or suspected that person, what kind of tests are run through that person, and how should one be prepared for those kind of tests?
That's a very important question because many people think or do an internet search and say, oh, I think
Yeah.
I've got this, I think I've got that, and they worry about sinister and serious problems. Common things are common. That's what we are taught in our medical schools. IBS is a very common problem. It is not a disease. So that myth should be taken off. It is not a disease. It is just a disorder or an imbalance the way how the digestive system works. So that's the most important thing. And that calms many people. There is no specific test to diagnose IBS. We use certain tests to rule out other possibilities that can mimic irritable bowel syndrome. Say, for example, an ulcer disease, an infection in the gastrointestinal tract. In an older person who has come in with some weight loss or some blood in the stools, we ought to rule out some other pathology or disease process, such as an inflammation in the intestine or a cancer or a growth. Fortunately, these kind of inflammations, bleeding tendencies, or growths or cancerous are still uncommon. By and large, 8 out of 10 or 9 out of 10 who comes to a gastroenterologist with these kind of tummy symptoms are diagnosed with irritable bowel, and it is very prevalent in the society and the community, especially in an urban society like ours.
All right.
Everybody has stressful lives,
Huh.
and everybody's perception or the way how they respond to the stress is different. Some people are chilled out, some people take it quite a bit, and those are the kind of people who are predisposed to have these kind of tummy issues.
Oh, okay, all right. I was reading through something, doctors, and I found that John F. Kennedy had a big history of IBS, and he was the youngest president of United States, and so did Adolf Hitler. These are the people who really admitted that they went through IBS. So,
Incidentally, they also had mood disorders.
oh, okay. That's
Absolutely. And to answer the other question you asked, are there any other tests? Yes, some of the tests that a gastroenterologist conducts is depending upon what kind of symptoms you have.
Okay.
If you have more of lower digestive tract symptoms, such as altered bowel habits, intestinal hurry, loose stools, blood in the stools, you may get a camera examination to look inside your digestive tract, called as a colonoscopy.
Okay.
Colon means large intestine, scopy means to see.
Okay.
Similarly, the upper digestive tract, which is the stomach and the duodenum, we do an endoscopy or an upper endoscopy called as a gastroscopy.
Okay. Does these endoscopy and colonoscopy come later in the investigation? Because it's all quite, is it painful? I mean,
As I said, if it's a young person who's in their late teens or early 20s who come with no red flag symptoms such as weight loss, no blood in the stools, or they're otherwise hale and hearty and they have a slightly an anxious predisposition or they're stressed out, we don't go for these kind of tests. We just educate them, reassure them, look into the personal history, what's bothering them, and then refer to our colleagues like Dr. Divyashree. However, an elderly person comes who's 50 plus, a postmenopausal lady with some issues, anemia, weight loss. These are the ones we need to rule out some sinister problems or organic disorders, and therefore we offer the test in the first instance. So it is all based on the kind of patient cohorts that we see.
So what I can conclude is that you need not really get worried about. I mean, even if you conclude that you have IBS. So in that case, next question that I have really is: once you have IBS, is it medication that solves, or is it a lifestyle change, or both? I mean, how does the management of IBS happen?
First and foremost is all about patient education and empowerment. Okay. So patient education. 60% of the times, many people are relieved that they have just IBS and all the misconceptions about this, that, ulcer, cancer, everything's gone. Many people half the problems are gone through the window. Patient empowerment, that is teaching people how to handle their symptoms, how to cope with their symptoms. And that's where people like Dr. Divyashree would help these kind of people to cope with these kind of symptoms. As I said earlier, it's not a disease, it is just a disorder. So you have good days, you have bad days. Coping with those bad days, Dr. Divyashree or one of our colleagues will be teaching them. Of course, extreme symptoms when they have a real affection in the quality of life, they can't do their work, they're disabled because of the symptoms, that's when we use medications, which can be for a short period of time, intermittent use, and very rarely we may have to use it for a prolonged period of time.
So how long should we, what, 3 months, 6 months, what is the kind of time frame that somebody should have in mind? Instead of getting panic, I pop in a few pills and in 1 week I am all right. Is that possible?
As I said, the answer to that lies in patient education. So we tell them you are going to have good days, bad days. Things are related to the stresses that they may be undergoing, diet that they're eating, and a lot of other things. So telling them that expect things to get better, sometimes things to get worse, how to cope with these kind of symptoms. But there's no timeline or a definite or a finite period saying that, okay, you're going to take this for 2 weeks or 2 months or 2 years. So we just say that we empower them. Yes, you can start these medications when you need, stop these when you don't need it. And if there are certain other medication which has to be supervised very carefully and closely, we bring them back into the outpatient departments or the clinics, and then we advise them at regular intervals, how much, how long.
Got it. So next question is to Dr. Divyashree. When people have these kind of anxiety issues and it results in some sort of much more than a butterflies in the stomach, do they directly come to, at what point should they conclude that they should come to a psychiatrist?
Right. Most of the times, people who have problems in their tummy and they get referred by a specialist. But if patients feel that, the stress is bringing about their symptoms, it all boils down to dysfunction, right? So if your symptoms are interfering with your day-to-day activities, that is, you're not able to function in your personal life, it is interfering in your eating habits, sleeping habits, it's interfering in your personal life in the sense you're not able to do your social activities, meeting people, etc., or occupational function, that is, you're not able to work. So if most of these areas are affected, that means it is something that needs to be really addressed. So that is when you need to come in. So when the symptoms are causing dysfunction, that's when you need to seek out help, and that's when you need medication or therapy.
Got it. Dr. Vidyasagar, at what point should somebody take it really seriously? What are the symptoms that this is beyond IBS? This seems to be something more sinister.
Yeah, that's a very important question because, like, some people think that they may have serious problems. Other people just do an internet search and say,
Right.
okay, I think I've got IBS and sit quiet.
Okay.
So if you're above the age of 40, 45 in men,
Okay.
above the age of 50 in women, if you're losing weight, if you have trouble swallowing food,
Okay.
if you're having anemia, that is low hemoglobin,
Okay.
and you're having blood in the stools, and you're unable to cope with these symptoms, this is when you need to seek medical attention without much delay. Because we do get caught out in people, which we have seen in our own clinical practice, that people think that they have got IBS and they've postponed and they're present quite late, and then we've seen that they have got some other serious problems like ulcers, cancers. But fortunately, they are still quite a rarity.
Okay. And what kind of tests are really advised for those kind of people?
Yeah, first and foremost, how people are assessed with these kind of symptoms is a thorough history,
Okay.
digging into their symptoms, how it's affecting their quality of life and the day-to-day work, and then a thorough physical examination and a battery of tests, starting with basic tests such as a blood and a urine test, maybe a scan, and in some special circumstances, yes, we do investigate with the help of an endoscopy, which is from the top end called as a gastroscopy, or from the bottom end, we call it as a colonoscopy.
Okay, got it. It looks like in conclusion, this is a pretty much an urban problem because of the change in lifestyle. Heavily, I mean, maybe there are other factors as well. But so, I mean, the question to both of you is, how should somebody who's reasonably healthy, has no issues like this, what should they take care so that they don't end up with IBS?
So one of the most important thing is that it's not specific to urban societies.
Okay.
Yeah, it can affect even the rural,
Okay.
the richest of the rich, and the poorest of the poor.
Oh, okay.
Okay? So that's one message that I want to send. Yes, of course, it's about awareness, and that's the whole point of today's session, to make people, the public and the community aware of this kind of condition.
Okay, got it. Do you have an answer on
Yes. So, like what Dr. Vidyasagar said, it seems to affect both groups, all groups. Another thing I wanted to highlight here was that people sometimes, because of their anxious predisposition,
Okay.
I think they seem to go from doctor to doctor and spend a lot of money.
Okay.
Once they have been assessed and they have been told that there doesn't seem to be anything wrong with your gut, everything seems to be okay, there is really no point going again and again for tests. You'll be wasting time and money and energy.
Okay.
Instead, if we can focus on management, people always want a magic pill, wonder drug. You just take it, you do a scan, find what the problem is, take it away, and I'll be fine. That's I think the mentality of a lot of people who go looking for looking for more investigations. Instead of wasting money and time on that, if we can focus on management, which is mostly, if there is an underlying mental health issue like an anxiety disorder diagnosable, or anything else which needs to be treated, medication or therapy, psychological management, where we teach them how to cope with day-to-day stresses.
Okay. Okay. Got it. And you don't recommend anything. So there is a common saying that don't eat anything that your grandma has not seen. So is that anything? So should we have any restrictions, dietary restrictions, or not really restrictions, some guidelines, so that we don't get it?
So I think eating a balanced diet,
Okay.
and of course mindful eating or a disciplined eating is all that is required.
Okay.
Because there's a lot of food fads that people say, oh, I need to eat a low carb diet, low fat diet, high protein diet, and so on and so forth. I need to go on this special diet, that diet. So diet, of course, is fuel for our body, and that's why there's something called as a balanced diet. You
Okay.
have to eat in the right proportions, and of course, people do enjoy having a cheat meal here and there.
Okay.
And of course, when you overindulge, you may get these kind of symptoms, but they are not called as IBS.
Okay.
But there are certain people whose bowels or gastrointestinal tract is more sensitive than usual.
Okay.
And there are certain trigger foods, say for example, lactose or milk for some people, wheat for some people,
Okay.
and spices for some people. So they need to keep a food diary and then follow what generally triggers their issues, and they need to avoid that. It's just basically common sense or prudence, that's it.
Okay, thank you. So let's see if we have a few questions.
Before that,
Sure.
can I ask a question?
Yeah, sure.
So I just wanted to know, I'm sure somebody would have asked already, is there a specific number of times that you know, which is ideal or which is normal for bowel movement? What would you want to say about
Okay. Yeah, I do get asked many a times. See, the WHO defines the normal bowel movements as up to three times a day or 3 times a week, and anything in between them is considered as normal. However, this varies from country to country, society to society, and community to community. We Indians, I mean, our tradition that we have to clear our bowels first thing in the morning before we have our bath, otherwise we don't feel fresh. These are all something that's ingrained from a very young age.
Okay.
And so many people get obsessed with these kind of things.
Okay.
So basically, we just have to attend nature's call. So the mantra is 3 times a day or 3 times a week, and anything in between is quite normal.
Sure. So we have a question from Mr. Kashi. He says, does exercising regularly, does it help handling all these?
Yes, exercising regularly is definitely a very, very good thing that you can do for mental health, because the same neurochemicals that are involved in taking care of your mood and concentration and anxiety are, it increases when you exercise, right? So it is like taking a small dose of antidepressant. So definitely doing exercise is extremely good. It will help you with controlling your stress and keeping you mentally healthy.
Sure. Thank you. So exercise always, I mean, regardless whether you have IBS or you do not have IBS, that's the answer. I think there's a good question here from Mr. Nitin. He says, will I get addicted to medicines if I use them for IBS?
See, rather than addiction, I would say, because sometimes the symptoms are quite overwhelming for certain people, that it affects their day-to-day lives, and they need to resort to medications to at least to carry on with the day-to-day work. So rather than addiction, it is probably called that they're dependent on medications, and without medications, their functional capacity becomes quite less.
Okay.
And these are not addictive medicines like, there are certain medications in the English medicine or the allopathy system of medicines like sleeping tablets, which are addictive, and painkillers for that matter.
Okay. There's one more question from Brinda. Brinda asks, is this hereditary? Are some people more likely to catch this?
See, there have been sort of genome-wide analysis to see if mood disorders or irritable bowel syndrome, but there haven't been, especially in the irritable bowel syndrome, we haven't seen any specific genes that are responsible for IBS. But it is more of a the family members share the same kind of food, same kind of environment and behavioral tendencies. So probably it's the environment factor which is more important rather than anything else. But of course, Dr. Divyashree is going to tell something more about mental health and genes.
Yeah, so anxiety is heritable. So if your parents are worriers, they have a tendency to look at things in a very negative fashion and worry about it, then it's very likely that you inherit that. That should not, be sensed as something pessimistic or, negative, because these are all things that we can learn. You can change your style of thinking by going through what we call cognitive behavior therapy. So, yes, anxiety and, tendency to think in a negative fashion and getting stressed easily can be heritable, but it is something that we can modify.
Okay, thank you. There's one final question. The rest of the questions we can take up later. Meghna asks, what if we leave tablet? That means discontinue tablet after taking it for 1 year. And will it recur in antidepressants? I think the question is for you.
Right. If you're asking me whether depression can come back, it is difficult to predict.
Okay.
Because it's usually an interaction between your personality, your predisposition, your genetic makeup, and the stress. Everybody is bound with enough stress, anybody can get depressed.
Okay.
So, if you've taken a medication for a year, that means you've treated this particular episode properly. But it is difficult to predict whether you can get another episode because it all depends upon the environmental stressors.
So we are closing the questions right now. If you have more questions, you should consult your family physician, or you can consult. There's one more question, it appears, but I cannot really see. So that's fine. So you can always consult your family physicians, or come to Optima Hospital. We are very near ISKCON, Bangalore, and consult Dr. Vidyasagar or Dr. Divyashree, or both as appropriate. For me, Dr. Vidyasagar and Dr. Divyashree, the whole idea, the takeaway for me was that, the biggest takeaway, because I did not know all these, was that this is not a disease, this is just a disorder. That itself is a relief. And the second one is, instead of jumping into many of these marketing diets, a mindful diet is what is needed. And learn to change. Right, so that is something which is really, those are the three takeaways that I have from this. A lot of misconceptions around this disease or disorder, so to speak, is being rectified with this session, at least for me, and I hope the same is with most of you. With this, I would like to thank Dr. Vidyasagar and Dr. Divyashree profusely for this patient education session on irritable bowel syndrome. Thank you so much. And I'm sure this irritable bowel syndrome will no longer be irritable, but it will all be an easygoing bowel syndrome for every one of us from this moment after the session. So thank you very much for attending. We'll be back on the 10th of October. That's next month. We have the patient education or the health education series 10th of every month. That's the next one would be 10th of October at 8 p.m. Until then, have a nice time, have a nice festival. Thank you very much. Good night.
Good night. Thank you.
Good night.
Thank you.